And so I was just telling her how I'm more of a fall girl. Her sentiment was the opposite. But then she said something else. Her mood actually changes. Do you have seasonal affective disorder? And she looked at me and literally said, I don't even know what that is. What is that? Hey everyone and welcome. I'm Tamika and I'm a board certified psychiatric mental health nurse practitioner. I also go by the name The Flagrant Psych MP. Now I run a private mental health practice here in Michigan that's 100% virtual. And at my practice, I manage adults with ADHD and mild to moderate depression or anxiety. A big part of what I do is patient education, and that's because in order for patients to take control of their mental health, they absolutely need to be equipped with the right tools, skills, and the knowledge to feel empowered to feel like they can successfully manage their own mental health journeys. Ultimately, that's what it's all about. Patients feeling empowered to take control even well after they leave my sessions. So that said, this channel is really geared towards providing mental health educational videos to help achieve that goal. But before we get into today's topic, I do kind of want to open with a story time. And so I was at the salon the other day and I was having a conversation with one of the young ladies at the salon, and we were talking about the weather. And specifically, I was just telling her how I didn't particularly enjoy the summer that we had this year in our state. And that's because it was miserably hot, in my opinion, right? So I love the summer, but I don't really like elevated temperatures. And it was a steamy summer this year. And so I was just telling her how I'm more of a fall girl. I'm looking forward to the fall. I actually like the changes in the seasons and all of the different colors, all of those type of things, right? Her sentiment was the opposite, where she told me she actually enjoys the summer. She loves it when the temperatures are elevated. She thrives in the summertime, so much so that she was even thinking about moving to Texas just for the continuity and the temperature and the weather. But then she said something else that led me to believe that the move to Texas was more than just about the temperatures, right? And what she said was that when we start to transition into the fall here in Michigan, her mood actually changes. Like she sees a drop in her mood. She feels like she falls into a funk. She doesn't want to do anything. She doesn't want to go outside. And so the clinician in me, I asked her, well, do you have seasonal affective disorder? And she looked at me and literally said, I don't even know what that is. What is that? And so I found so much irony in that conversation for a couple of reasons. Number one is because I was actively in the process of creating mental health videos, or a mental health video about seasonal affective disorder, to kind of educate people about what it is and how it presents. And then in the same breath, I was actually kind of going back and forth with myself about, do I really want to put this video out there? Do I really want to create this channel? Do I even want to put myself out there like that? Because I actually hate being in front of the camera. But I will say that conversation at the salon, it kind of served as like divine intervention for me. It was almost like confirmation to let me know that, yes, you're doing the right thing. This is what you should be doing. Continue moving forward with what you're doing. So that said, I kind of just threw caution to the wind, and here I am today. I also should say that I do feel like part of my purpose is to help do my part to decrease the stigma surrounding mental illness. So again, if you're watching today, this is my very first video on this YouTube channel. And I thought it would be fitting to have a conversation with you today about something that does tend to sneak up on a lot of people around this time of year, and that is seasonal affective disorder. And some people refer to this as the winter blues, but this is more than just about feeling down and a little, sad or in a funk when the seasons change. SAD is a real diagnosable mental health disorder, and it can seriously impact your motivation, your energy, and just your overall well-being. And so as we start to creep up on the fall months, this is going to be the time where you start to see those symptoms creeping in. And that's because the days are getting shorter. There's less natural sunlight. And honestly, if this is something that you think that you're contending with, you might already be noticing dips in your energy and your mood. And then if you're already diagnosed with SAD, then you already know what to look for. And so you're probably already bracing yourself for what's to come. But I will say this, guys, the key to managing this is to get ahead of it. And so I want us to start practicing from a perspective of being proactive versus reactive. And I think with the right strategies in place that you will definitely be able to do that. And part of what I'm doing in today's video is I'm going to be providing you with some very effective and evidence-based strategies to help you manage those symptoms of SAD this season. So let's start off by defining SAD. What is seasonal affective disorder? Well, it is a type of depression, but it's a depression that's specifically related to changes in the season. And again, you'll start to notice the symptoms maybe late fall, and they may continue into the winter months. And that's again because the days are getting shorter. There's less natural sunlight. And some of the core symptoms of SAD include things like feeling low or sad nearly every day or mostly every day. You may notice that you're having difficulty focusing or difficulty concentrating. You might be sleeping too much, or you might not be sleeping well for that matter. Some patients are going to notice that they're craving carbs or gaining weight. And then some people are going to notice that they're losing interest in things that they typically like to do. And so if all of these symptoms sound familiar, know that you're not imagining it and you're not alone. All right, so how do we diagnose SAD? Well, most providers are going to start by asking for your presenting symptoms, meaning what type of things are you saying? What are you contending with that makes you feel like this is SAD? We're also going to take a full history, and then we're going to try to rule out other causes for the symptoms that you're experiencing. We're also going to look at timing, and we're going to look for patterns, especially if you're telling us that these symptoms recur around the same time every year. Now, how do we treat SAD? So we're going to use a combination of evidence-based approaches, both non-medicated and medicated options. Now, before I go into those options, I am going to preface this by saying that I am a provider who's a huge proponent of tapping into your skills before we start relying on pills. And what I mean by that is I am going to challenge you to kind of assess what do you already have on board, or what can I help you develop that you already have on board that can help us to successfully manage these symptoms outside of medication. But that said, I am going to provide you today with, again, some effective and evidence-based, both non-medication and medication options to help you manage these symptoms. I'm going to start with the non-medication options first, and then I'll follow up with the medication options. So the first non-medication option that we're going to talk about to help you effectively manage symptoms of SAD is going to be a lifestyle changes or lifestyle strategies approach. And that's going to include things like movement, social connections, and getting outdoors. And now how do these things play a factor? Well, we're going to talk about it, and we're going to start with movement, specifically regular physical activity. And that's because that's one of the most accessible and effective ways to help you manage symptoms of SAD. So when you're increasing your physical activity, you're also going to be increasing the neurotransmitters in your brain that are responsible or that help regulate your mood. And neurotransmitters are chemical messengers in our brain that it helps the brain cells and the nerve cells kind of communicate with each other. Think of it as like text messages that the brain sends to the rest of your body to help you regulate everything from your heartbeat to your mood. And so increased physical activity is going to be helping to regulate those. So things like serotonin, dopamine, and norepinephrine, these are all key players in mood regulation. Improved physical activity or increased physical activity is also going to help improve your sleep. That's because think about it. When you're moving most of the day, you're going to be physically tired by the end of the night. And so essentially, you're going to sleep better. You're going to rest well. Physical activity can also help reduce your cortisol levels. Now, that's the body's stress hormone. So essentially, if you can reduce the cortisol levels, your mind is going to be able to relax and sleep better at night. You can also calm your nervous system with more increased physical activity. Calming the nervous system is going to help reduce symptoms of anxiety. And stress and anxiety are things that are commonly seen when you have that diagnosis of seasonal affective disorder. And this one might sound strange, but increased physical activity is also going to help increase your energy levels. When you think about it, when you're increasing your physical activity, you're increasing your blood flow and oxygen levels to your brain and to your muscles. And this is going to help you feel more alert and awake during the day. Movement also helps to improve your circadian rhythm. Now, the body has its own natural alarm clock that helps you kind of understand when it's time to be awake versus when it's time to go to sleep. But regular physical activity can help to reset this clock and make sure that it stays on time. That way you feel awake when it's time to be awake and more sleepy when it's time to go to sleep. So essentially the recipe is move more, sleep better, feel more energized. And some of the best types of physical activity for SAD are going to include things like aerobic exercise like walking, jogging, biking, or dancing. Yoga is a good activity to engage in, yoga or stretching. That's really going to help to decrease symptoms of anxiety. You could do strength training. That's really going to help with resiliency and building confidence. You can also engage in things like group classes or partner workouts, and that adds like a social component piece to things, which is another important aspect that we're going to talk about in more detail a little bit later. But essentially 10 to 30 minutes of physical activity is going to do wonders for helping you to manage those symptoms of SAD this season. And so let's talk about social connections as another effective lifestyle strategy that you can use to help manage symptoms of SAD. Very powerful tool, but I think it goes underestimated. Now, when people have SAD, they tend to self-isolate and withdraw. And that's actually the last thing that you want to do, because you're actually going to be making the symptoms worse when you do this. You're going to be feeding into the loneliness, feeding into the negative self-talk and negative thoughts. And so making social connections, and I'm not just talking about like social media, but making an effort to stay connected, even in small doses, is going to be very, very powerful for helping you manage those symptoms of SAD. Again, right off the bat, you're going to be increasing those natural feel-good or mood-boosting neurotransmitters when you're making social connections. And staying connected with family and friends can motivate you to do things like go outside, get exercise, stick to your routines, and even to get help if your symptoms start to get a little bit worse. And so social connections are huge, or social accountability is huge when your motivation and energy are low. You want to be careful here, though. You want to make sure that you're making supportive, positive connections and not connecting with people who are going to go against your mental health goals. Now, getting outdoors is another very effective lifestyle strategies or lifestyle changes approach that you can use to help manage symptoms of SAD. Now, during the fall and winter months, especially in the northern latitudes, the days are going to be shorter. We're going to be getting less natural sunlight. And so ultimately, that's going to reduce the skin's ability to synthesize or make vitamin D. Now, vitamin D is used to make or produce serotonin, which we already talked about as one of those key players in helping to regulate mood or boost the mood. So essentially, if there's less sunlight, there's less vitamin D, there's less serotonin, which can increase the likelihood of you seeing all of those symptoms that are associated with SAD. Some research even shows that people with SAD tend to have less vitamin D, and that supplementation with vitamin D can actually help improve symptoms of SAD. One of the things that I do in my practice at an initial evaluation, if I assess you and you tell me that you haven't had any labs done within the last 12 months, I'm probably going to order them for you. And what I'm going to be looking for, one of the things I'm looking at are your vitamin D levels. And I want to determine, could you benefit from a supplementation of vitamin D? So all of that said, keep in mind, though, that the evidence for vitamin D is not fully conclusive, and that vitamin D is only one piece of the puzzle, right? Here's something else to consider. People with darker skin also tend to have a vitamin D deficiency, and that's because the melanin in their skin tends to make it more difficult also to synthesize vitamin D. And so what do we do in those situations? Or what do we do if getting outside is not really a viable option for you? Now, that's going to lead us into our second non-medication option that is effective for helping you treat symptoms of SAD, and that's light therapy. So what is light therapy? So this is going to involve you using a special lamp that is essentially mimicking natural sunlight. And what the lamp is trying to do, it's actually trying to regulate your mood and sleep cycles. So it's trying to improve, again, those neurotransmitters that are responsible for increasing your mood or regulating your mood. Now, to get the best benefit out of light therapy, you really want to use it first thing in the morning, ideally within 30 to 60 minutes upon wakening. And you want to avoid using it late morning or midday or even late in the afternoon, because you can get into a situation where it's going to impair your sleep quality. So generally, it's recommended that you do it anywhere between like 6 a.m. and 9 a.m. But again, even that's going to vary depending on your individual schedule. And so how long do you need to sit at the light box for each session? Well, that's going to depend, right? And that's because you may have some people who may have more mild symptoms of SAD. They only may need about 20 to 30 minutes per session. Whereas somebody else who has like a slower biological clock, or maybe there's somebody else with a darker skin tone, again, they may benefit from longer sessions, maybe up to 45 minutes per session. And then you have some people who are more photosensitive, and they may actually respond to light very quickly. So they may benefit well from only 15 to 20 minutes per session. I'm going to also give you some tips on how to use the light box. When you're sitting at it, you don't want to look directly into the light. Now, you do want to keep your eyes open, but you kind of want to allow the light to hit your peripheral vision. And you could actually be engaged in something else while you're sitting at the light box. You could read, you could eat breakfast, you could respond to emails. Another thing of importance is the lux rating on the light box. And that just simply means, what is the intensity of the light that is coming out of the box at the distance that you're sitting? And so, for example, let's say you have a 10,000 lux rating box. From about 16 to 24 inches away, you're probably going to do good at about 20 to 30 minutes per session. Whereas if you had a 2,500 lux box, at the same distance, you're probably going to have to sit for about 1 to 2 hours to get the same dose. So it's really important that you're looking at the lux rating on the box of the light box. And then you want to see, based on that lux rating, how far should you be sitting from that box. All of that said, the most important thing about these light boxes are that you are consistent. You want to be consistently using them every day, especially during the fall and winter months, to get the best benefit. And generally speaking, it's recommended that you get a light box with about 10,000 lux for best results. Though rare, there are some side effects to be considered with the light box, and some of those include headache, nausea, or eye strain. If you experience any of these type of side effects, you could try to decrease your sessions, like start with slower sessions and try to work your way up to longer sessions. You could also try to increase the distance from the box to see if that helps. Now, if the symptoms persist and they're too intolerable for you, even short sessions may not be a good option for you. And here's another word of warning. If you have bipolar disorder, or if you're being evaluated for bipolar disorder, you want to talk to your provider first, because some light boxes can actually trigger mania in some people. And so the last non-medication option that we're going to talk about for effectively managing SAD is therapy, specifically cognitive behavioral therapy, or CBT SAD. Now, unlike light therapy that's actually targeting biological factors, CBT SAD is more about targeting behaviors and negative thoughts or distorted emotions. And what the therapy is attempting to do is to help you identify those distorted thoughts or negative thought loops, and then help you replace them with something more helpful or realistic. So say, for example, you have the thought, I'll never be better until spring. With CBT SAD, you'll learn to replace that thought with something more positive, like, yeah, winter is hard, but I've gotten through it before and I have tools now. So essentially here, we're replacing the negative thought with realistic thoughts, which helps to reduce emotional suffering and make space for hope and motivation. So the recipe is change the thought, lead to better emotions and more positive actions. And when you're in therapy, you can work with your therapist to create like a seasonal wellness plan, sort of like what we're doing here, to understand, like, if you start to see dips in your mood, what can I do? What realistic plan do I have to help me stay social, to help me stay active, to help me get outdoors? And then also, it's good to learn to track your progress and track your moods. And this helps you and your provider to understand what's working well versus what's not. So if you need to go back to the treatment plan, you have a good starting point on where you need to make adjustments. Now, research has actually shown that CBT SAD is just as effective as light therapy when used that first winter. And then if you combine CBT with light therapy, that's going to be a very, very powerful combination for some people. All right, so we talked about some of the non-medication options that are available to help you effectively manage SAD, but the reality is that for some people, just a non-medication route is not going to be an option. And in that case, you will have to have a conversation with your provider to determine, like, what are my medication options? And for some, antidepressants are going to work wonders in helping you manage those symptoms of SAD. Take, for example, bupropion or Wellbutrin. That is an antidepressant that is FDA approved for symptoms of SAD. Now, it's going to work best for people who have like yearly predictable patterns of SAD. But even in those cases, there are other options like your SSRIs, or what we call selective serotonin reuptake inhibitors. And these medications work by selectively blocking the reuptake or the reabsorption of serotonin. Let me put it to you this way. So kind of think of serotonin is like a message, right? And the SSRIs block that message from being deleted too quickly so that the brain can read it longer, thereby increasing the mood, increasing the level of serotonin. And now, of course, medication can be used alone or in combination with things like CBT, SAD, or your other lifestyle strategies that we talked about. And these are all details that you'll have to sit down and discuss with your provider to kind of determine what's the best path or treatment option for you. Okay, so I know we talked about a lot so far, but before we end, we have to talk about the long-term management of SAD. Like, how are we going to manage this thing long-term? And if SAD has been a pattern in your life, again, it's worth taking a proactive approach. Remember, we opened the video by saying we're going to practice from a perspective of being proactive versus reactive. And that means getting ahead of things. So what does that look like for you? Maybe you need to start checking in with your provider earlier, maybe late summer, early fall, and maybe start having a discussion about adjusting your medications if that's applicable to you, or just having a plan in place or knowing what do I need to do if I start to notice that there are dips in my mood and or energy. So again, if you see yourself in any of the information shared today and you've never been evaluated and you're wondering if what you're experiencing is more than just a seasonal slump, I encourage you to take this step to seek help. So I am accepting adult patients across the state of Michigan. Remember, I'm 100% virtual. I will leave the link to book an evaluation with me in the description box, or you can visit my website at www.theflagrantpsychnp.com. So let's get ahead of the season and get you feeling stable, supported, and prepared, because your mental health matters year-round. Thanks so much for tuning in. If you found this information helpful, leave me a comment, share it with a friend, and be sure to subscribe. Until next time, take care of yourself.
Take a whole day to recognize sunshine. When you need someone, I will be by your side. There is a light that shines. That's for you and me. Yeah.